everyone, my name is Ann Saffron-Dalen. I'm a person living with diabetes, previously on meds and now controlled by better food choices. I'm also a transplant recipient. I'd like to welcome you back to another edition of the National Kidney Foundation's Facebook Live series. This is the first of a three-part series on diabetes, heart, and kidney disease, and today we're going to focus on diet and nutrition. Today, I'm lucky to be joined by Dr. Eugenia Gianos, Dr. Rafia Chaudhry, and Amy Hess-Fishel. Dr. Gianos is a cardiologist, which is a heart doctor. Dr. Chaudhry is a nephrologist, which is a kidney doctor. And Amy Hess-Fishel is a dietitian. Welcome, everyone, and thank you so much for taking part in today's Facebook Live.
Thank you for having us, Ann.
I'm glad you're all here. Thank you.
Pleasure.
Rafia, I'm going to start with this question because as a nephrologist, can you please set the stage for how eating habits is a common denominator in kidney disease, diabetes, and heart disease?
That's an excellent question to start with, Ann. I think in the last 20 to 30 years, we've recognized how dietary habits and lifestyle can really have a huge impact on things like high blood pressure and diabetes, and therefore in turn be the common denominator that brings together the heart and kidney disease system. And so if we're able to control the risk factors such as high blood pressure and diabetes, we can really have a significant impact on controlling cardiovascular disease and kidney disease.
Thank you. That really does tie it together very well. And Amy, I'm going to start with the first question for you. How can people get nutritional and how can they get help with nutritional and lifestyle changes? And do you suggest that everyone consult with a dietitian?
Well, as a dietitian, of course, I'm pretty biased. I'd love for everyone to see a dietitian. Absolutely. You know, again, when we think of nutrition services and medical nutrition therapy, because that's the kind of a technical term, you know, seeing a dietitian will help you to be able to individualize your needs. Now, a really cool thing to understand is that it is a covered benefit. So when we think of Medicare Part B, again, for renal, for diabetes, you're allowed 2 hours of medical nutrition therapy every year. Now, that requires a referral from a physician. Now, another even cooler thing that people don't realize is that you can obtain additional medical nutrition therapy hours with an additional referral if you've had a change in your treatment. So the sky is the limit when it comes to Medicare coverage. Now, when we think of commercial pays, we know that that's pretty much in line with Medicare, but you'll have to check with your plans. But, you know, definitely we want to be able to meet your needs. And as with a dietitian, you want to have realistic goals, and seeing someone a few times will help you to meet those goals.
Well, I had no idea about the additional benefits that were available. And I've been dealing with this for years, so I know that the viewers will appreciate hearing that as well.
Secret.
Eugenia, do you have anything to add to that?
Absolutely. I think historically, unfortunately, in modern medicine, as physicians, we've often focused a little too much on end-stage therapies, medication, and not given value to how much nutrition can do for a patient. So for starters, I think, you know, I've made it my responsibility, and I try to encourage other physicians to do the same, to start the conversation with a patient. Some basic education about nutrition, some educational handouts, and really even in a minute, as long as you're expressing how important this is for a patient, and then connecting them to the right resources. Dietitians are expert in this, so they can do this, and we really need teams of people to be taking care of our patients.
Agreed. I'm glad to hear you say that, because once you're diagnosed with something, and it should be even before that, working with the doctor should be a team. They should be partners in helping with your recovery and to improve your health. So I'm glad to hear you say that. I really appreciate that. Sure. And now, Rafia, I'd like to move on to you. And if you could suggest some tips for controlling the intake of salt in somebody's diet.
Yeah, thank you, Anne, for bringing up such an important point. Like Eugenia mentioned, sometimes, you know, as physicians, we just give recommendations, you know, low salt diet. And what does that really mean practically? And so some of the things that I talk to my patients about are, for example, fresh is always better than canned. So fresh vegetables or fresh fruits are always better, because a lot of the canned foods, they will have salt added to it in the process of preservation. So it is always better to do the fresh. Additionally, it's better if you're able to avoid adding salt on top of food and rather just cooking with salt, because you can control and really know how much salt you're adding and try and minimize it. Eating at home or cooking at home is always better than eating out, because it's difficult to gauge or control the amount of salt in that situation. Another thing I tell my patients is to avoid processed meats. Preferably we do recommend having more vegetables, fruit, plant-based diet. But if you have to have meat, then, fresh meat is again better, and poultry and fish is probably better than red meats in general for cardiovascular and kidney disease. And then the last thing I would say is snacks, right? Sometimes we're paying so much attention to meals, we forget about the crackers and the nuts that we might have that have salt in them. So it's, again, shifting towards munching on, vegetables or changing your snacking habits. I think those are some realistic strategies that have a huge impact on reducing the amount of salt in your diet.
And I think looking at the nutritional information on packages is especially helpful, because certain nuts maybe per portion may have 100 milligrams of sodium, which is not very much, but other ones may have much more. And then regarding eating out, I know people that like to go to certain restaurants and they love the soup that's offered. It's got between 12 and 1,500 milligrams of sodium per serving. Of course it tastes good, but it's not something that we necessarily want to have. And regarding vegetables, frozen is another good way to go, because when vegetables are out of season, at least we know those are fresh frozen, and we're making them as if they're fresh. So I think that may be another addition that people may want to consider. Does anyone else have anything to say regarding salt?
Yeah, absolutely. I think Rafia and our fields really do work on what we call like fluid balance and sort of moderating, how much salt you're taking in, and are you having swelling? Are you retaining too much water? Things like that. So this is so important, and it's very key to blood pressure, to heart failure patients, to many people. And telling somebody, your daily limit of salt should be about 1,500 milligrams of sodium can be really perplexing. Like, what exactly does that mean? So I think that those recommendations of just, if you're, you don't have to worry about how much salt is in a cucumber. You don't have to worry about those fresh foods, and fruits and vegetables particularly are the way to go. And then, sometimes you see that a single serving of something, as you said, the soup's, 1,200, 1,500, if you read the label and the single serving is almost your daily supply, you're definitely going to be in trouble. So I think those basic principles, most of your foods being natural, being low salt, being whatever, and then if you once in a while had a few olives, or you had that they're salty, you just have to be really careful.
Well, one other thing that happens is that somebody looks at a can of soup or a package of soup, and it looks like one portion. So they eat the whole thing. So right there, they've doubled it. So it kind of negates what they're trying to do. So yeah, being very aware of packaging and nutritional information provided makes a big difference for how they can proceed and do it in a healthy way. Absolutely. So now I'd like to move on to something else that, especially if someone has diabetes or any other health issues, it's a big topic and one that everybody talks about. And Amy, I'd like you to provide some tips on how to control the intake of sugar, please.
Sure, of course, Anne. And one thing that we have to distinguish, of course, is that in diabetes, and I know you already know this, Anne, is that we're really focusing on the carbohydrate, because carbohydrate is what breaks down into sugar. Now, we can separate and say everyone in the world should be reducing their added sugars. But when we talk about carbohydrates, again, we all need some carbohydrates in our normal eating patterns, but it's the how much that we have at one time that's going to increase our glucose levels. So that's a very individualized kind of plan. And that's where continuous glucose monitoring or self-monitoring of blood glucose really helps somebody to understand how much can I tolerate at one time? Or if I'm taking medication, how do I adjust that to help my glucose levels? But the bottom line is not all carbohydrates carbohydrates are bad, and not all sugars are bad. Because again, if we think of milk sugar, fruit sugar, all of those, they are healthy. It's just in the volume that we're actually consuming. Now, we know that the nutrition recommendations that have come out from the American Diabetes Association, as well as the Academy of Nutrition and Dietetics, the mothership of dietitians, again, basically says, there are a variety of ways that people can, choose their eating patterns, and low carb is an option. But we do have to kind of distinguish what is considered low carb. And so again, really, getting back to that first question of really working with a registered dietitian nutritionist to understand what's going to work best for you, but reducing the amount of carbohydrate that somebody has helps reduce calories, definitely, but also will help with blood sugars. So again, certainly reducing those added sugars is a biggie. Again, let's not have regular soft drinks. Again, there's no real reason for anyone to be having a regular soft drink, with the exception of maybe if they have to treat hypoglycemia. But, again, really simple ways of those caloric beverages that really add no nutritive value. That's a good way to reduce those sugars.
Thank you. Yeah, it's made a huge difference in my life. Absolutely. And everybody's need for carbohydrates is different. I know that if I'm not having bread, whether it's whole grain bread or any other bread or pasta, and I'm having vegetables, except for corn or potatoes, I don't have to worry about how much spinach or broccoli or cauliflower I'm having. I'm still getting carbohydrates, but it's the quality and the number of them that makes the difference. And then when I look at my blood sugar readings in the morning and in the evening, I can pat myself on the back and say, this is the right choice for me. So it's like I said, it's made a big difference for me in how I proceed.
And you you hit that nail on the head, is that for you, again, various patients like, oh, wow, I really found the sweet spot of what I can have at this meal or this meal. And so, it's really, everyone is going to have those aha moments differently. And so that's awesome, Anne, that you found what was right for you.
And fortunately, there are some things that I can use that have lower carbohydrates that I can use as a substitute for other things. I mean,
Like what?
When it comes to cauliflower rice, and some people go, oh no, it works for me.
Excellent.
It absolutely works for me. And when I have cauliflower rice with it, let's say I've made a stir fry. Once you put your chicken and vegetables over that, to me, it's the same thing.
Yeah.
So I've learned to adjust how I eat. And look, I've eaten every food on the planet. So it's not as if I need to have it again if I want to keep my health in a good place. So again, as you said, not one size fits all when it comes to how you eat. And I think that's important for people to understand. So Eugenia, I'd like to move on to our next question. And what is the impact of cholesterol, LDL, and triglycerides on heart health? And how can someone manage their cholesterol with nutritional changes?
Right. So one important thing is, I think that sometimes historically we've gone for looking for one enemy in the diet. Is it just get rid of salt and you'll be fine? Just get rid of sugar and eat anything else you want, or just get rid of, fat, where it's really not that simple. And, having too much bad fat, saturated fat, having too much salt or sugar is actually not good for you. With respect to heart disease, LDL, which is the bad cholesterol, is, we believe, causal to heart disease. It is what causes very frequently plaque accumulation in your arteries. So one of the main goals of medical therapy, whether it's with medical treatments or diet, is to get that LDL as low as we can get it. And a lot of times we can achieve that with a good diet. Getting your LDL lower, some of the key components to that are lowering how much saturated fat you have in your diet, which usually is predominantly from various animal products, butter, ice cream, meats, cheeses, and then having more fiber in your diet to help lower your cholesterol, sometimes even 20, 30 grams of fiber from various foods, blueberries, oatmeal, potentially, that green leafy vegetables, chickpeas. There's a variety, and you can choose which ones work for you. It doesn't have to be any particular ones. Everyone's different. So that's the mainstay for the LDL. The triglycerides, though, are somewhat, they're also believed to be causal to heart disease, and sometimes come along with those high sugars and early diabetes and insulin resistance and things like that. And that's also very important to keep down. And you can lower those with lowering your intake of saturated fats, but also sugars or carbohydrates that get turned very quickly into sugar. So all are important, and everybody should really know what their individual numbers are. Work with their doctor, and then work with a dietitian or nutritionist.
Right. And unfortunately, things like grains do cause inflammation, which causes it causes your blood sugars to go up. And when blood sugars go up, the inflammation affects everything in our bodies. So I think I'm sorry,
yeah,
go ahead.
Oh, sorry. Absolutely. Inflammation is one of the key components of atherosclerosis, which is the plaque in the arteries. And we definitely know now that that is a part of that whole process, and not a good part. Having said that, and everybody is different with respect to grains and whether they feel they work for them or they don't. The literature, for the most part, has not, when you look at everything together, suggested that we eliminate whole grains. As a matter of fact, they've looked at research with patients who, did, in an effort to get gluten-free or low gluten, et cetera. And, when you get rid of whole grains, you get rid of a lot of fiber very often. And that has not always translated into better outcomes. So, certainly we work individually with patients and what works for that person. Some people feel better when they eat certain foods than others, but for the most part, it's, grains or fiber in general are definitely heart healthy for the most part.
Okay, now we're going to move on to another area, and I'd like to have each of you, and we can start with Rafia, then Eugenia, maybe Amy, and discuss some strategies for nutritional management for diabetes, heart disease, and kidney disease. We've discussed it a little bit, but let's include some of the things that you all suggest and some of the things that you suggest that people avoid.
Sure, thank you. And I think that's really nice to put it all together and get all of our perspectives, because we, again, want to give realistic recommendations and realistic practice habits. So I think Dr. Gianos can elaborate more on plant-based and, a Mediterranean diet and the benefits from a heart standpoint. But what I will say is, while we encourage patients to focus more towards plant-based or vegetarian diets, we do have to keep in mind, as a chronic kidney disease, if you do have chronic kidney disease, hopefully we're making these lifestyle changes earlier. As the chronic kidney disease advances within the vegetable and the plant-based diet, it is important to take into account kind of one particular thing, which is the potassium level in the vegetables or fruits, because as your kidney function declines, the ability of the body to get rid of potassium can go down, and some of the medications that we like for kidney and heart disease actually bring the potassium level up. And so, trying to achieve that balance, it's important to understand, again, with in collaboration with your doctor and your dietitian, what vegetables and fruits might be better to incorporate in the diet and what to limit or go down on the portion size on. So, for example, bananas are great, but they have a lot of potassium in it, along with carbohydrates and sugars. So it might be better to kind of, limit the amount that you're having in your diet. And apples might be a great substitute because they have less potassium in them. So that's what I would say. And I would turn over to Dr. Giannis to talk more about the benefits of the Mediterranean or the plant-based diet.
Thank you, Rafia. Eugenia?
Great. That's a great explanation. I think that sometimes we think that we're not able to have anything, but there are options if you just get the right advice. I would say that mostly what we're taking care of nowadays is a sort of a combination of a lot of these different things when it comes to patients. Most of the patients we see have a little bit of diabetes, are somewhat overweight, have mildly elevated cholesterol and hypertension. And, we're really treating all of those together in one patient. Some of them also have heart disease. And I think from my standpoint, a single diet really, and the way I view it is a spectrum kind of a plant predominant diet. So And I would say that I also was guilty of something that Anne was bringing up earlier, of like when I was in college, I thought anything low fat was healthy. So a plain bagel, of course, or frozen yogurt, that's healthy, it's low fat, you know. Not at all. You don't really get much nutrients from that. You don't really get very much energy other than for about a half an hour, and then you kind of crash. So, you know, learning those concepts again. So, you know, plant predominant diet means that you are going to incorporate a lot of, you know, vegetables and some fruit and some whole grains and legumes and in the bulk of your diet as you can. And if you want to be fully plant-based and you can do it in a healthy way that potentially might be the most heart healthy, a Mediterranean diet has absolutely been shown to do the same, which is also a predominantly plant-based diet. There are, you know, some amounts of fish, of lean meats and poultry, and a little bit of dairy, nuts, olive oil, etc. But these are both similar type diets. So with my patients, I tend to explain, you know, eating along a spectrum, even if you go from processed meats to unprocessed lean meats, you've made a, you know, a big change. If you've added a single vegetable to your diet, you've made a change. If you eliminate soda from your diet, you know, you've made a big change. So all of those are, you know, in the same direction, and I think has a lot of benefits that you can get to a stage when you eat healthy like this, as Anne said, that you have tremendous improvement in your medical issues, which is great.
Absolutely.
Thank you. And Amy?
You know, I think I wanted to circle back to what Eugenia said before, is that, you know, first, there's no one food, there's no one thing that is, you know, that we should demonize when it comes to meal planning. It's an eating pattern, you know, and so we do have to focus on everything as a whole. But to that point is that, you know, the one thing that we as Americans, but also even outside of the US, we do not eat enough fruits and vegetables. And so exactly what Eugenia said, what Rafia said, you know, again, if we all made two really big changes in how we're eating, is can we increase our fruits and vegetables? That improves cardiovascular health. Yeah, again, it preserves kidneys. It improves diabetes care. And so again, all of these things, you know, can be improved if we are just making some slight eating pattern changes that focus on really looking at that kind of that plant-based choices. And we know that the outcomes really show that it has some great benefits.
True. I have multiple conditions, having had diabetes, heart disease, and a kidney transplant. Sometimes other people find it difficult to figure out what to do with when it comes to food restrictions, like the things you spoke about. I mean, fortunately, I've reversed my type 2 diabetes. I'm down to a 5.1 A1C. I've been taking off all of my blood pressure medications, and I barely take any heart medications. And I do it through dietary, nutritional changes, and also adding some exercise. And I walk like crazy now. So it's made a huge difference. So to that, we're going to take some questions from the audience, and we're going to take a minute to allow the viewers on Facebook to ask the questions. And if you have any questions on this subject, please post them in the Q&A or the chat section, and we'll do our best to get to the answers, as many as we can. Please know that if we run out of time, because this discussion has been all-encompassing, it's been great, all your questions will be answered on the NKF Facebook page in coming years. So I'm going to go to the first question. And this one is regarding how much water should I drink each day?
That's a really great question, but also has, I think, a little bit of a complicated answer. And the reason I say that is because it kind of depends, again, on your underlying, you know, kidney disease, heart disease, your comorbidities. The reason I say that is that a lot of the patients that Dr. Gianos and I, you know, help manage are at different stages along the line of whether, you know, they have congestive heart failure, for example, or if they have advanced kidney disease. And in that case, if we have you on water medications to try and control the fluid balance that Dr. Gianos alluded to earlier, we probably want you drinking, you know, a little bit less water. So restricting fluid intake to maybe 1.5 liters a day, for example, but also mainly cutting back on the sodium or the salt. So it depends on what the underlying kind of, you know, where you are in the process And so really talking to your doctor and engaging in conversations is good. I don't want to give a specific number because I don't want to mislead the audience. We probably have a broad spectrum of audience. And so it would be very confusing to give one specific number is what I would say.
Thank you. I'm going to move on because we do have a few questions, but that was a great answer. And this one is interesting. Somebody says, I have type 1 diabetes and high potassium. Do I have kidney disease?
It's quite possible because in general, so there could be a couple of reasons. Just insulin deficiency alone can cause the potassium shifting across the cells in our body to change. And so primarily, usually potassium is inside the cells. Without insulin, it kind of moves out. In most cases, the potassium can be controlled by the body if you do not have kidney disease. But I imagine that if you've had type 1 diabetes for a number of years and you're now experiencing high potassium, you most likely do have kidney disease. But again, it's the best way to find out would be to get labs, both urine and blood tests, and then talk to your doctor about it.
Okay, thank you. Another question is, they're interested in becoming a vegan. Is almond or oat milk okay? Amy or Eugenia?
Yeah, Eugenia, why don't you take that?
Okay.
I think, certainly, again, we don't have large scale research trials that have put people on oat milk versus 1% versus 3% to say, okay, who's doing the best here overall. We do know that predominantly plant-based diets do have a lot of benefits, and there is some question in terms of dairy as to how much benefit there is even in just milk itself. I think that there's a little more evidence that things like yogurt or cheese might have a little bit more health benefits, but overall, a diet that has smaller amounts of dairy may be, overall healthy. So yes, but substituting those can give you, benefits in terms of lowering the amounts of animal content in your diet, which is also key. And I think one thing to keep in mind is that we think of saturated fat predominantly, maybe we think of the protein in foods and the carbohydrates, but things that come from animals also have a component in them that when broken down in your gut actually has been associated with heart disease. Complex trimethylamine, which gets broken down in the gut, it's called TMAO, and has been associated with heart disease. So limiting, and I'm not saying that you absolutely have to eliminate animal products, limiting them can be beneficial.
Okay, thank you.
One thing I just want to add though, Anne, is that for almond milk or any other milk that's not animal based, double check that it does have calcium and vitamin D fortification. So again, if you're going to really move towards vegan, you want to make sure that you are getting some of those additional benefits that you're going to get from some animal products.
And again, with something like almond milk, cashew milk, the others, some have a lot of sugar. So it's important to read the packaging for that. If you're going to make a substitute, make sure it's not one that's sweetened, because otherwise it defeats everything.
Agreed.
So those are important things to think about for all. And somebody else was asking about, and this is mentioned, but maybe you can go into a little further, about the Mediterranean diet for diabetes.
Sure. So, Eugenia, I'll start, and Eugenia, you can.
Yeah, absolutely. That'd be great.
Certainly the Mediterranean diet has been found to be beneficial in a variety of ways, but I think that people do have to understand what Mediterranean means. Now, when we think of true Mediterranean, around all of those countries that are around the Mediterranean, they all have very different types of foods that are involved. So our version of Mediterranean may not be as healthy as it may be in Greece or in Morocco. So again, it's just important that, again, it really comes down to increasing vegetables and fruits. That's usually kind of the underlying of all the Mediterranean, the diets, and then also some of the whole grains. So, certainly it still comes down to carbohydrate, how it's going to impact glucose levels, and how much somebody's consuming.
Right, exactly. Thank you.
That's right. Yeah. And if anything, I think they've seen in those studies for the Mediterranean diets that they decrease inflammation, decrease insulin resistance. So potentially, yes, they, can decrease diabetes. As a matter of fact, plant-based diets have also been shown to decrease diabetes. So definitely a good thing.
Absolutely.
And one other thing regarding the oils, I'd like to know, Amy, your opinion on using things like olive oil, avocado oil, as opposed to seed oils. Do you have an opinion on that?
Versus sea oils?
Seed oils, such
Oh,
as
seed oils, I'm
canola
sorry.
oil. I'm sorry.
I know, see, not seeing, not being face to face sometimes. I'd say if you look at the distribution of the types of, what's in some of these oils, again, unless somebody's having very large quantities, certainly, Eugenia, with these olive oil studies, again, it's, they were having multiple tablespoons per day. If somebody just has a tablespoon and they're, making their vegetables in a wok, it doesn't truly matter what kind of vegetable oil that they truly use. It's really the volume that they have. And so the one thing, as Eugenia even mentioned before, is that you can't really hone in on just one thing and say, oh, well, seed oils versus olive oil are better in the context of the entire eating pattern. And I think that's really important, that use what you like. Again, olive oil is wonderful with vegetables, but not good if you're making, again, some type of a baked product, so, I think that it really does come down to the volume, but they all do have unique benefits. And still, vegetable oil is not going to, we know that it's a healthy fat, so to speak, when it comes to monounsaturated, polyunsaturated.
Okay. And what about nutritional needs combined with exercise?
Oh.
How will that affect our bodies? Eugenia, as a cardiologist, that's something I know you must speak about with patients frequently.
Yes. Exercise by itself for weight loss sometimes is not as effective if you just start
Right.
exercising or whatnot. But when you do the two together, it can be very, very, your success is sort of skyrocketed with that. The key thing is that I think for exercise in and of itself, it has so many health benefits. So it helps the arteries of the heart and of the body actually, relax better. So it can improve your blood pressure. It causes the entire parasympathetic nervous system, which is the system that causes your heart rate to calm down and to sort of relax, to improve. It can help you with the triglycerides. I have to say that that's one of the most effective way of getting your triglycerides down. We've seen astounding things where people are active and then all of a sudden, something like COVID happens and then they've, become a little bit sedentary on occasion. And, the triglycerides go up tremendously. So very important to keep in mind that both are really beneficial. And when you do them both, your chances of success are really, really great.
Thank you. And we have one final question we're going to get to, and it's regarding the low carb, keto, which is a lower carb version than low carb. And it's helping many people to reverse their health issues. And I'd like to get, again, your opinions on that. And Eugenia, if you'd like to start.
I would love to. I have a fairly strong opinion on this one, actually. We've seen a lot in cardiology, unfortunately, and I focus a lot on cholesterol or lipids, is what we call lipidology. And, when patients, certainly the ketogenic diet works in the short term. It is a very good way to lose weight short term. However, it is often done in a fashion, in order to have such low carbohydrates in your diet, you have to be eating, very, very fat heavy and protein heavy foods, which often many patients do end up eating a lot of animal-based products predominantly in these diets. And we have seen very elevated LDL levels, bad cholesterol, and we've seen also, heart disease develop in the setting of these diets. In theory, and some people are advocating for this and trying this, is doing a plant predominant diet, and you can do it with like salmon and avocado and nuts and things like that. Still challenging, and it's still just a acute phase sort of thing to get you jump started. And then the key is that you really need to get to something that's sustainable for the rest of your life. So I'm not a big fan of those types of diets, but really finding something, for a lifetime.
Okay, thank you. And Rafia, one more question, and it's regarding caffeine. Is that something that if someone has diabetes or any other health issues, is this something you recommend or dissuade people from using and having?
Yeah, I think, anything again in real life, you want to do it where it's sustainable. And so I don't recommend to my patients completely stopping caffeine, but limiting the intake of caffeine to maybe, ideally no more than 1 cup of coffee a day. And the reason is that high caffeine intake has been associated with high blood pressure, which again, kind of ties together advancing heart disease, advancing kidney disease in the long term. So I think that in general, I do recommend to my patients to control the caffeine intake and limit it. You don't have to eliminate it altogether. And the one thing I'd like to add is that all of these together, any habit takes at least 3 weeks to develop. And so it's those sustainable changes, not to overwhelm yourself with trying to completely stop caffeine or decrease portion size or change, to plant or vegetable-based diet. It's all small, slow changes over a longer period of time. So it's more sustainable and it's truly a lifestyle change.
Great, thank you. That was a good answer for this. And it looks like we've run out of time. I want to remind you that in case we didn't get around to answering your question here, please check on the National Kidney Foundation's Facebook page, where we'll be posting the answers in the next day or so. You can also contact NKF's helpline. It's toll free at 855-NKF-CARES. At this time, I'd like to thank our sponsors for being so supportive in helping make this program possible. I'd especially like to thank our guests, Dr. Giannos, Dr. Chaudhry, and Amy Hess-Fishel. Thank you so much for helping me with our viewers talk through this subject. It's been very important and super helpful.
Thank you, Anne. Great discussion.
You're welcome. And again, delighted that you've all been here today for our viewers.
Always a pleasure to see you again, Anne.
Thank you, Amy. On behalf of the National Kidney Foundation, Women, Heart, and Diabetes Sisters, I'd like to wish you all good health